I'm Gloria Kiefer Preston, and I'm a physiotherapist, and I work at the David Braley Sport Medicine and Rehabilitation Center, and that's at McMaster University. I've been working here at McMaster for the last 9 years. I have been practicing physiotherapy for the last 20. My job involves assessment and treatment of musculoskeletal and sport medicine injuries. On the first visit, someone would be here for approximately half an hour to an hour, and they would get a complete assessment of the problem, and usually within that time we would also do a little bit of education and a bit of treatment. At home, there are some things you can purchase that would help you. Generally, having tight muscles in the lower extremity and wanting to release tension in that, you could use a foam roller, which is relatively inexpensive, about $20, and they can be purchased. And you would be shown how to do it and which muscle groups to do by a therapist, and it takes a couple minutes a day to do. If you're looking and needing some strengthening exercises, you can purchase TheraBand, which is really inexpensive. It's just a couple dollars a feet, like $2 or $3. And that could be used to strengthen up some muscles in the ankles and shins. And I think balance is an important component for a dancer. So if you're looking to work on some balance exercises, you don't need to purchase anything. You can use something like a pillow or a couch cushion and practice some balancing on that. And one other thing, actually, because you're going to need a good core stability as a dancer, another piece of equipment you could use is exercise ball. That would be a really good thing to have too. With warming up, you want to be taught how to do a good dynamic warm-up. So mainly, again, lower extremity for a dancer, but some upper extremity as well. So doing some dynamic ballistic movements for 5 to 10 minutes, and then also being shown some static stretches, predominantly for the lower extremity. And with dancers specifically, I would say calf muscles, foot muscles. So those would be some warm-up and some stretches that you would want to focus on in that group. Mainly for prevention of injuries. So if a muscle is properly warmed up, it's less susceptible to trauma and to being injured. So I think just for reducing the incidence of injuries, that would be a good thing to do. Oh, absolutely. So big component of physiotherapy is the education component. What's the problem? Why does someone have the problem? What's the cause of the problem? And what can we do to treat it? And what can we do to prevent it from becoming a chronic problem? So absolutely, I think you would get those components in physio, that you would be taught how to manage the injury at the time and how to prevent it from reoccurring. I would say immediately, because even if you can't, start, even if you're doing relative rest from the activity, there's still some inflammation going on, possibly some swelling, so you want to take care of that right away. So I would say do not wait. If it's too early to start a lot of treatment, then that would also be education that you would find out. It depends what the injury would be, but definitely taping can play a big role in providing some extra support and stability to a joint, possibly an ankle, or trying to limit excessive movement at an area. So definitely I think there's a role for taping, for sure. When you are exercising, you're actually traumatizing your muscle tissue. So what happens is there's always a little bit of micro damage that happens at a cellular level when something is being put through repetitive strain. And so the tissue will heal and mend itself, but definitely there's a little bit of micro trauma that happens when we do exercise at the cellular level. If you get a little bit of micro trauma, the tissue will heal, and so it'll lay down some scar tissue to heal itself, but oftentimes the scar tissue isn't quite the same as the original tissue it's trying to replace. It's not quite as elasticy. And then if you keep doing this over and over, you get into this cycle of the tissue constantly laying down some scar tissue. And oftentimes it can be more thick and, like I said, less flexible than the original tissue, which makes that tissue easier to injure, and then you get into this terrible cycle of constantly re-injuring that tissue. That's when people get a lot of chronic pain. Yeah, so I'm not sure if it would prevent, but it would definitely help limit the susceptibility. Yes, because you would be using different muscle groups all the time, and so some muscle groups would get a chance to get a break. The other thing that helps with injury is rest. So when you're working out a muscle, if you want to build strength, you want to work it out about 3-4 times a week. But like I mentioned, because there is that little bit of micro trauma going on at this cellular level, the tissue needs time to repair. So exercising or dancing 6-7 days in a row, not a great idea. Your body actually needs the recovery time. It needs a chance to heal and repair. So usually every other day is ideal, as opposed to 7 days in a row. I mean, usually some non-weight bearing things like cycling, swimming, would be things that you could do to maintain some cardio. And for general core stability and strengthening, we can usually find something that's not irritating to the injured area. So if someone has a lower extremity injury, they can keep doing upper body weights and strengthening exercises or core stability exercises. So very, very few are the times where someone is completely unable to do anything. There's usually something they can do. Like immediately to treat the inflammation, you want to do your typical rest the injury from the aggravating activity, ice the injury to decrease the swelling and the inflammation. If there's a lot of swelling, you can elevate or put some compression on the joint as well. Physiotherapy uses a couple modalities, machines like ultrasound and massage, things like that, to help reduce the inflammation and the swelling as well. The main thing is to figure out the cause of the problem though. So why is the person getting Achilles tendonitis? So it could be a biomechanical issue, the way their feet are, the way they walk. So then you would want to look into things like orthotics. Or is it training issues, like the type of surface they're on, the type of footwear they're wearing, how often they're training? So there's lots of training things to address. And then generally what is going on with that person? Are they a really tight person who doesn't stretch a lot, or they have lots of ankle sprains, so they have a very hypermobile joint and they maybe need to strengthen and work on some more balancing? So someone could have the same injury. Two people could have the same injury but for different reasons, and so you would ultimately need to figure out the root of the problem to fix it.